All right, welcome back, everybody. It's 9:13. In the world of cancer treatment, there are a lot of questions. Why has the cancer come back? Why did it spread? What's the best way to treat it? Well, we've got Dr. Diane Heaton this morning, radiation oncologist, medical director of Oklahoma CyberKnife, joining us to explain the difference and then also talk a little bit about CyberKnife as well, an open house coming up. Thanks for coming in, Dr. Heaton.
Oh, thank you very much.
Appreciate you coming in. Now, we were just talking a few moments ago about the different kinds of cancer. You were telling me about recurrent cancer first.
Correct.
Is what we want to talk about.
Yes, recurrent cancer is when the cancer comes back in either the same or a different location. So we've treated it once, and then such as a renal cell or a lung cancer will come back in the lung or come back in the liver or other areas. Those are still very treatable, and we are looking to try to treat the appropriate patients.
Yeah, you're also talking about metastatic cancer, and you're telling me you guys are treating and seeing more of that as well?
Absolutely. As our medical oncologists improve, every once in a while one little cell will get away, and we'll need to attack that, and sometimes it's very appropriate to do that with CyberKnife.
Now, also, how are they different?
How are they different? They differ from when you first start, like a lung cancer will first start in the lung and then grow. Metastatic or recurrent will either come back after it was treated or go in the bloodstream or the lymph vessels and go elsewhere into the body.
All right. So the neat thing about it, and I know you've been to talk about CyberKnife in the past, the neat thing, you guys can pinpoint those particular areas. That's what makes CyberKnife so different and works so well for so many people.
Absolutely. Particularly when there's only a few, we can pinpoint the areas where the recurrence has come back, and then in association with our other colleagues be able to develop a treatment course. And I've seen patients live years. I saw a lady just last week who I first treated in 2010 with brain metastasis, who now is, 5 years later. And
5 years later after the brain metastasis was discovered. Wow, that is amazing.
And she's a unique patient, but there are patients like that.
And so what are some of the other benefits? Because when we talk about having a lot of people say they make that choice that they want to use the CyberKnife either in addition to some of the other therapies or on its own. Why is that?
Both can be appropriate. The big thing is that we're looking for patients that have, relatively fewer metastatic sites or can be easily treated with other modalities, and then we do kind of the cleanup work at the end.
A lot of people have questions about CyberKnife. I mean, you hear the word knife and cyber. It's all, the new technology and everything. Explain a little bit how it works for folks, and then we'll tell them about an open house you guys have got tomorrow.
Absolutely. It is a unique machine. It actually is a radiation machine on top of a robot, and that robot will allow me to get down to 0.4 millimeter accuracy.
Wow.
And then also it breathes with the patient. It's just an amazing piece of equipment. So I can keep that accuracy throughout the entire treatment course, and the machine will x-ray, find where you are, how you're breathing, develop a model of your breathing, and just an impressive mold of computers, robotics, and radiation.
Okay, there's still a lot of things you could go on and talk about the benefits.
Yes.
But if people have questions, really the best thing to do is go to your open house, right?
Absolutely. Please come out and take a look. We are opening this to the public, and we very, very much want people to come out and see what we're doing.
All right, Dr. Heaton, as always, thank you, ma'am.
Thank you.
It's good to see you again. Thank you very much.
You're very welcome. Thank you.
Oklahoma CyberKnife, the open house is tomorrow from 4:30 till 6:30 at 6802 South Olympia Avenue, 918-949-6676. Should they call and say they're coming?
They can just
no cost. Just show up. Just show up. Okay. OklahomaCyberKnife.com, whencancercomesback.com as well.